Dr. Kim Langdon with CCM Health. I'm here to discuss the topic of arthritis. Arthritis affects a lot of people, so we'll be discussing what your risk factors are, some of the signs and symptoms, how it's diagnosed, and how it's best managed. So with that, let's talk about arthritis. Two main forms are osteoarthritis and rheumatoid arthritis. So what is arthritis? Well, it's a common disorder. It's inflammation of the joints. It can cause pain, makes it difficult to move and stay active. There can be degeneration of the joints. Arthritis most commonly affects areas of the body such as the feet, hands, hips, knees, and lower back. It's very common. It's a common cause of disability. 50 million adults have this, as do 300,000 children. And what causes arthritis? Well, different types of arthritis are caused by different things. For instance, gout is when you have too much of uric acid that builds up in the body, then deposits in the joints. But the other causes of arthritis are not entirely known. But family history is important, as it is with any condition. If you play a job or have played a sport in your earlier years that had repetitive stress to the joints, or if you have an autoimmune or viral infections, can lead to arthritis. Different types of arthritis have different symptoms. They can be mild to severe. The pain and discomfort can come and go. So pain is the most common. Swelling, tenderness, stiffness. Sometimes you have warmth or redness of the joints. Risk factors, as we age, we tend to get all sorts of diseases, including arthritis. Women tend to get arthritis more than men. Smoking and lack of exercise can lead to arthritis, and obesity puts extra stress on your joints. So it's kind of a dual-edged sword. If you don't get out and exercise, then you put more weight on the joints, and that leads to more arthritis, and then that leads to pain, which then discourages you from exercise. So it's best to just try to slowly lose weight so you can keep up an active lifestyle. All right, so what are the different types? Osteoarthritis is most common. That's the wear and tear one we talked about, repetitive usage of a joint from sports or work. So the cartilage breaks down, so bone ends up, grinding on bone. Rheumatoid arthritis is more of an immune system problem where your own immune system attacks the synovial membranes, which are sort of the fluid-filled membranes near the cartilage that protect the bone from rubbing on each other. Ankylosing spondylitis is basically just a form of arthritis of the spine, usually the lower back. Juvenile arthritis starts at age 16 or younger. Gout is when you have little crystals, they're hard crystals of uric acid that deposit in your joints. And then psoriatic arthritis. Sometimes you'll get joint inflammation near the joints where you have outbreaks of psoriasis. So here's pictures on the left of a healthy joint. See the blue area that's protecting the bone from grinding on bone. That's sort of the cartilage and synovial membranes and fluid. Osteoarthritis, as you can see, there's, partial breakdown and there's still some space and inflammation, but rheumatoid arthritis, you can have very, very stiff, almost immobile joints because of the bone on bone and no lubrication between the two bones at the joint. So osteoarthritis is the most common. Sometimes it's called the wear and tear arthritis, as we mentioned. Your joint begins to break down. The underlying bone can change. You can get bone spurs. You can get stiffness and swelling, achiness, and you might not be able to do the things you used to be able to do. The things that cause osteoarthritis is basically damage and the breakdown of the joint cartilage between the bones. And the symptoms, as we've described, are pain or aching, stiffness, tenderness, decreased range of motion or flexibility, swelling and bone spurs. Definitely notice it in your wrist. Sometimes it's difficult to open up a jar of food or something like that. What are the risk factors for osteoarthritis? Well, overuse, repetitive action such as knee bending, and repetitive stress on the joint. As we age, just life and inflammation tend to cause more problems. Women are more likely to develop OA than men. That's thought to be due to lower estrogen after the menopause. Obesity puts extra stress on the joints. So how is OA treated? Well, increasing your physical activity slowly, muscle strengthening activities. You might need to have a cane or a device to help you move. Try to lose weight. Anti-inflammatory medications can be helpful, and in severe cases, surgery may be needed. If you want to self-manage osteoarthritis, improve your quality of life, you're going to need to learn more about the disease, get physically active, lose weight, protect your joints from additional trauma. So what is rheumatoid arthritis? Well, it's an autoimmune inflammatory disease, which means your own body attacks the cells of the synovial membranes, causing inflammation, usually attacks the joints. The hands, wrists, and knees are most common. The lining of the joint becomes inflamed, and the tissue damage can be long-lasting and create chronic pain. And rheumatoid arthritis can also affect other tissues in the body, such as the lungs, heart, and eyes. That's because of the autoimmune mechanism behind that. So rheumatoid arthritis, similar symptoms: pain or aching, stiffness, tenderness, swelling. Sometimes you have the same symptoms on both sides, or maybe more severe on one side or the other. You could have fever, swelling, fatigue, and tiredness and weakness. So if it's more of a systemic disease than osteoarthritis. As we talked about, your immune cells are not working properly. So for whatever reason, through genetics or exposure, an autoimmune process comes out and starts attacking healthy tissue, which puts you at increased risk of the disease. Rheumatoid arthritis can start at any age, but the incidence increases with age. It's 2 to 3 times higher, likely to develop in women. And the couple of genes, one called the HLA, or the human leukocyte antigen class 2, is associated with worse arthritis. Smoking, women who have never given birth are at greater risk for rheumatoid arthritis. Interestingly, if you grew up in a household where parents smoked, you're more likely to get rheumatoid arthritis as an adult, obesity as well. So we can effectively manage these with what's called disease-modifying anti-rheumatic drugs, DMARDs, and biological response modifiers to settle down the overactive immune system. There's some self-management strategies and some anti-inflammatory medications to relieve the pain. Some complications of rheumatoid arthritis are systemic, such as premature heart disease. You're at higher risk of developing this, heart disease and diabetes. So it's important that you see your doctor to be evaluated for these additional risk factors, also to stop smoking and lose weight. Rheumatoid arthritis can make it very difficult to work. You're less likely to be employed. And as the disease gets worse, you're not able to do as physically demanding jobs. So there are some complications that are very significant for rheumatoid arthritis. So the best thing to do is get physically active, maintain a healthy weight, stop smoking, and become educated about your condition. So how we diagnose this? Well, no single test can identify rheumatoid arthritis. I mean, physical exam, you're going to look for certain things like swelling and redness. Blood tests can be done for anti-CCP and anti-nuclear antibodies to look for the level of inflammation. X-rays, MRIs, and ultrasounds might be done. The X-ray is more beneficial for detecting osteoarthritis, but you might not find rheumatoid arthritis by a simple X-ray. So it's a constellation of symptoms and other tests that confirm the diagnosis. Which one is worse? Well, Rheumatoid arthritis is more complex and more widespread disease. It can affect more than just your joints, but every patient is different, so it just depends on your particular circumstance. Osteoarthritis is usually localized to the joint, and you can replace a damaged joint. Whereas rheumatoid arthritis, there's many joints involved. It's unlikely that replacing the joint will have as much benefit. Both are chronic diseases. Neither is curable, but addressing the symptoms and preventing the progression are the mainstay and focus of our therapies. Thank you for listening to our talk on arthritis, osteoarthritis, and rheumatoid arthritis. You can learn more about it by visiting our website and our social media outlets. And thank you very much. We'll look forward to our next videos.